Today our lecture is eruption of teeth. Diffodont mean two sets of dentition in human, primary and secondary dentition. Mixed dentition mean presence of two dentition in the same time. Teeth in primary dentition are smaller and fewer in number than permanent dentition to confirm the smaller jaw size. Primary dentition begin from 2 to 6 years of age, while mixed dentition from 6 to 12 years, permanent dentition above the 12 years. This is the picture shows the deciduous dentition or primary dentition. This is in the upper jaw, only 10 teeth in each jaw. This picture shows a photograph OPG, shows mixed dentition, presence of permanent and deciduous dentition in the same time. Tooth eruption refer to the cutting of the tooth through the gum, is the process by which developing teeth emerge through the soft tissue of the jaw and the overlying mucosa to enter the oral cavity, contact the teeth of the opposite arch, and function in mastication. Therefore, it is a continuous process. Type of physiological tooth movement: either axial or vertical movement, primary eruption movement along the axis of the tooth, or drifting movement. It is the bodily movement in the direction perpendicular to the long axis of the tooth, like mesial or distal drift. Torsion, it is a rotary movement around the longitudinal axis of the tooth, and tipping movement around the transverse axis of the tooth is called tipping. Pattern of tooth movement or phases of tooth movement. We have three patterns or three phases of tooth movement, which include pre-eruptive, eruptive, and post-eruptive tooth movement. Pre-eruptive tooth movement, which include all movement of primary and permanent tooth germ, mean crown, from time of their early initiation. Mean here the early initiation, which mean the dental lamina formation, and the formation to the time of crown completion, mean end with early initiation of root formation. So the pre-eruptive phase begin from the early initiation of dental lamina to complete crown formation, while eruptive tooth movement start with the initiation of root formation and may by teeth to move from its position within the bone, mean inside or intraosseous, to its functional position in occlusion, has an intraosseous and extraosseous movement, mean outside the jaw. Third, post-eruptive tooth movement takes place after the teeth are functioning to maintain the position of the erupted tooth in occlusion while the jaw are continuing to grow and compensate for occlusal and proximal tooth wear. First, pre-eruptive tooth movement. The developing crown move constantly in the jaw during the pre-eruptive phase to place the teeth in position for eruptive tooth movement or second phase of tooth movement, and it occurs to reduce the problem of the jaw growth, which allow second molar to move backward and anterior teeth to move forward. Second, developing crown move constantly during the pre-eruptive phase as they respond to the positional changes of the neighboring crown and to the change in the mandible and maxilla. What's the 2-point mean? During the development of deciduous and permanent teeth, there is crowding of the teeth with the small jaw So to reduce this crowding, the anterior teeth move forward and the posterior teeth or molar move backward, and also the adjacent teeth become movement from each other to reduce the crowding, and also at the same time the mandible and the maxilla of this baby also grow at the same time. Third, permanent teeth develop lingual to the incisal level of the primary anterior teeth, and later as primary teeth erupt, the permanent crown are lingual to the apical third of the primary root. What does this mean? Permanent teeth lingually develop. At the beginning, it developed in the lingual to the incisal level of the primary anterior teeth. And after that, when the eruption of deciduous tooth occur, this location of this permanent successor is located at the apical third of a primary or deciduous root. Fourth, permanent premolars move from the occlusal level of the primary molars to the position enclosed within the primary tooth root. At the beginning, when the permanent premolar is developed, it located lingual to the occlusal level of a primary molar. When this primary molar is erupt, the level of permanent premolar is located between the tooth root of primary molars. 5. All movement in the pre-eruptive phase occur within the crypt of the developing crown, mean that the deciduous and permanent tooth locate in the same bony crypt, which the bony crypt represent the developing alveolar process. Here, this drawing picture shows the anterior teeth. This is the deciduous and permanent successor, and this the molar deciduous, and this is the permanent premolar. Here, both of deciduous and permanent tooth locate in the same bony crypt, and the permanent anterior tooth is located lingual to the incisal edge of the deciduous tooth, while when the tooth in function, the deciduous tooth is erupt and in function, the permanent incisors locate in the apical 1/3 of the deciduous root, and all of them is located in the separated alveolar process, like here and here, while in A, both located in the same bony crypt. For deciduous molar and permanent premolar, the permanent premolar at the beginning locate in the lingual to the occlusal surface of the deciduous tooth, and when the deciduous erupt, molar deciduous erupt and begin in function, the permanent premolar located between the two root of this deciduous molar. Pre-eruptive movement of the teeth are combination of two movements, which include total bodily movement and eccentric growth. Total bodily movement of the tooth germ, for example, during bodily movement, all the crown is move at the same time. When it moves in a medial direction, the bone resorption by osteoclast occur by the pressure on the medial surface of the crypt wall, and bone deposition occur by osteoblast on the other side, on the distal wall of the filling in process, while eccentric growth mean in which one part of the tooth germ remain fixed while the rest continues to grow, leading to a change in the center of the tooth germ. During eccentric growth, only bony resorption occur, thus altering the shape of the crypt to accommodate the altering shape of the tooth germ. Mean in eccentric growth, One part of tooth germ is remain fixed while the other part continues to grow. There is only bone resorption, while in total bodily movement, bone resorption in the pressure side occur and bone deposition in tension side occur. The second phase of tooth movement is the eruptive tooth movement, which is the main part of tooth eruption. This occur in four major events occur in eruptive tooth movement. The first and the most important event here is root formation. Space is required for root formation. Proliferation of hair-tooth epithelial root sheath, initiation of root dentine and pulp formation occur, increase in fibrous tissue of the dental follicle. Second event is the movement. When the root formation is occur, the movement of the tooth is occur incisally or occlusally. The main reason for the movement is so that the root can form normally and space need. Reduce enamel epithelium fuse and contact with the oral epithelium. Third event is the penetration of the tooth crown, tip through the fused epithelium layer, allowing the entrance of the crown into the oral cavity. Epithelial layers mean reduced enamel epithelium and oral epithelium. Fourth event is the intra-oral incisal or occlusal movement of the erupting tooth, continuous until the clinical contact with the opposing crown occur. This means when there is eruption in the lower teeth, it continuous movement until reach to the opposing upper central tooth. This the four events we discussed before. This is first beginning of root formation by presence of epithelial diaphragm or epithelial root sheath here. And this the beginning of the movement after root formation to have space here for root formation. Third event is the emergence of merge of the reduced enamel epithelium which cover the enamel crown, fuse with the oral epithelium here, and the beginning of the cusp tip to merge inside the oral cavity. Fourth event is the continuous movement, extraosseous tooth movement to reach the antagonist here. And this is JE mean the junctional epithelium. This is the active eruption of the tooth, and this is the passive eruption of the junctional epithelium or dentino-gingival junction, which discussed in the previous lecture. This is also the tooth during eruptive tooth movement. This is the root formation, and this is the crown, and this is the fusion of the reduced enamel epithelium here with the oral epithelium and the beginning of the cusp tip to merge inside the oral cavity. And this is the formation of the after fusion of reduced enamel epithelium and oral epithelium, the formation of primary epithelial attachment or junctional epithelium, and this is the enamel space, and this is the dentine of this tooth. This is the penetration of the crown of the tooth inside the oral cavity, and this is the formation of the junctional epithelium here, and this dotted line represents the enamel surface, and this is the oral epithelium, this is the free gingiva and this attached gingiva, and this is the permanent successor of this tooth. This is the primary tooth, and this is the permanent or developing tooth, mean the permanent successor which located lingual to this deciduous tooth. And this is the dentino-gingival junction or junctional epithelium. We have histological changes occur during eruptive tooth movement or during eruptive movement phase, either overlying the tooth or surrounding the tooth or underlying the tooth. In overlying the eruptive tooth, the histological changes occur is by macrophage. The macrophage cells destroy the cells and fiber by secreting hydrolytic enzyme to distract the connective tissue above the eruptive tooth. Also, osteoclasts begin to start to function are found along the border of the resorptive bone overlying the teeth, and this loss of bone keeps space during eruptive movement. We need space overlying the eruptive tooth to get eruption. So the macrophage will start to function, osteoclast also, and fibroblast also, to degenerate the fibrous connective tissue above the tooth. The tissue space overlying the teeth become visible as an inverted triangular area known as eruptive pathway or gubernacular canal, which appear as a hole noted in the dry skull lingual to the primary teeth in the jaw. As the successional teeth erupt, the gubernacular canal widen, enable the tooth to erupt. Also, we have gubernacular cord, which is the connective tissue overlying a successional teeth or tooth that connects with the lamina propria of the gingiva. This histological picture shows this is the space or gubernacular canal or eruptive pathway of the tooth to erupt in this direction. This is the connective tissue, this is the bone surrounding the tooth, and this here the location of the tooth. This is the oral epithelium. This is the space, this inverted triangular shape space covering the eruptive tooth. This is the molar tooth crown, and this is the root of this tooth. During eruptive tooth movement overlying this tooth, this is the triangular space which occur due to the function of the macrophage and osteoclast cells and also fibroblast cells, which degenerate the connective tissue, fiber and bone and blood vessels and nerve, which located here for formation of this space to facilitate the eruption pathway. And this is the fibers remnant of dental lamina, which is discussed previously in tooth development lecture, which is called epithelial cell rest of series, present here. This drawing picture shows the same histological pictures which discussed previously. This is the gubernacular canal, and this is the gubernacular cord, which represent the dental follicle fibers with the epithelial rest cell of series. This gubernacular cord which guide the tooth toward the eruptive pathway. This is the bone resorption, and this is the cord like here. And this is the incisal edge of the tooth will enter in this space to reach the oral epithelium and to erupt here. This is the dry skull of the boy with this is the deciduous teeth, and this is the gubernacular canal present palatally, represent the area where the permanent successor will erupt from this area. The histological changes occur surrounding the eruptive tooth. The surrounding fibers change from being parallel to the tooth surface to bundles that are attached to the tooth surface and extending toward the alveolar bone. Special fibroblasts have been reported in the periodontium of the erupting teeth, which is called myofibroblast, have a contractile properties. During eruption, collagen fibers formation and turnover are rapid. turnover means the formation and degeneration of these collagen fibers, which is occur by fibroblast and myofibroblast, are rapid, enabling fibers to attach and release and attach in rapid succession. Some fibers may attach and reattach later while the tooth moves occlusally as a new bone formed around it, and the fibers will organize and increase in the number and density as the tooth erupts. This picture shows the histological changes occur surrounding the eruptive tooth. This is the surrounding eruptive tooth. In A, this is the first formation of fiber, which is called alveolar crest fibers. This is the beginning of root formation and beginning of the formation of collagen fibers, which attach the root tooth with the alveolar process. B, tooth below alveolar crest. This is the during eruption of the tooth. This is the beginning of eruptive phase, and this is the after tooth inside the oral cavity. This is the arrangement of these fibers is increased with the increased root formation. This is attached fibers with the alveolar process. A, the initial fibers. B, the another fibers, and this is the attached fibers. And when the tooth reaches to the occlusal plane, the attachment of these fibers is corresponding by the formation of principal fibers of periodontal ligament, which represent the alveolar crest fibers, horizontal and oblique fibers, and apical fibers. These fibers during eruption is formed and then degenerate to allow this tooth to erupt. So the turnover of these fibers is very fast to allow the tooth movement and attachment of these fibers with the alveolar process. Histological changes underlying the eruptive tooth, below the tooth. As the tooth moves occlusally, it creates space underneath the tooth to accommodate root formation. Fibroblasts around the root apex form collagen that attach to the newly formed cementum. Bone trabeculae fill the space left behind as the tooth erupts in the pattern of ladder-like, which get denser and as the tooth erupts. After tooth reach functional occlusal, periodontal fiber attach to the apical cementum and extend into adjacent alveolar process. These fibers called apical groove fibers. So the histological changes occur underlying the eruptive tooth include the to continue to the formation of fibers and bone to fill the space which is left below the erupting tooth. So this space is filled by the formation of the dentine of the apex, cementum of the apex, and collagen fibers in this area by the apical groove fibers, and also the formation of alveolar process in the apical region. This is the area below the eruptive tooth. This is the root, and this is the pulp. This is the epithelial diaphragm, and this is the apical foramen. This area is called the fundic area. This area below the tooth is called the fundic area, which is like a space left below after the tooth movement in occlusal direction. So this space will filled by the formation of dentine to fill the apical region, and cementum, and also periodontal fibers in the apical region, and also the formation of trabecular of bone to fill this fundic area. Possible causes of tooth eruption. Although all the factors associated with tooth eruption are not yet known, the following may be the possible cause of tooth eruption. First of all, root growth and pulpal pressure. Second, bone remodeling by bone formation and bone resorption. Third, vascular pressure in periapical area below the root. Fourth, periodontal ligament traction, mean the contraction of periodontal ligament. 5, enzymatic degradation, also endocrine influence. We have the post-eruptive tooth movement or third phase of tooth movement. Why this occur? 2, movement to compensate the growing jaw. Mostly occur between 14 and 18 years of old by formation of a new bone at the alveolar crest and base of socket to keep space with increasing height of the jaw. This movement occur to accommodate the growing jaw, occur between 14 and 18 years of old to compensate the growing of the upper and lower jaw. Second, movement to compensate for continued occlusal wear. When the teeth during mastication, there is always occlusal wear. So compensating primarily occur by continuous deposition of cementum around the apex of the tooth to compensate occlusal wear. However, this deposition occurs only after tooth move, similar to eruptive tooth movement. Third, movement to accommodate interproximal wear, compensated by mesial or approximal drift. Mesial drift is the lateral bodily movement of the teeth on both sides of the mouth, very important in the orthodontic. Interproximal wear between two adjacent teeth when there is a contact area between the two adjacent teeth have interproximal wear due to the mesial and distal drift. We have sequence and chronology of the tooth eruption. Chronology of a human primary dentition, jaw, maxilla or mandible, and the teeth, first and second central incisor, canine, and first and second deciduous molar. Calcification when begin inside uterus, and the crown completed postnatally in month, time of emergence in month, root completion in years, and emergence sequence. Here the emergence sequence. The first emergence in the oral cavity is occur in first lower central incisors, and second in upper central incisor, third upper lateral incisor, and so on. And the root completion when occur in 2.5 years for upper maxillary central incisors, and also in lower central and lateral incisors, and 4 years for the second deciduous molar, and so on. Chronology for human permanent dentition, also for maxillary teeth and mandibular teeth. The first tooth to emerge in the oral cavity is the lower first permanent molar, which occur in time of emergence from 6 to 7 years. Crown completion 3 to 4 years, and the calcification begin at the birth, and so on for the all remaining teeth. Clinical consideration of tooth eruption. We have a problem of primary tooth eruption like natal and neonatal tooth. This natal tooth is the presence of erupting tooth inside the oral cavity of the baby at birth, while the neonatal teeth is eruption of teeth after 1 month or 2 months after birth, and this tooth causes the irritation to the soft tissue adjacent to it, and like in this area, the ulcer in the tongue. Also, we have congenital missing teeth. This OPG radiograph shows the location of congenital missing upper lateral incisors and also the permanent lower premolars. This congenital missing teeth also called hypodontia. Also, we have hyperdontia or supernumerary teeth, or a lot of teeth here in lower and upper jaw in this patient. Also, we have condition called osteopetrosis, which, because of defect in osteoclast, this occur. This is the histological section of this condition, shows the bone formation, mature bone. This is the osteocyte and this is Haversian canal without or less bone resorption. This caused the delay in the eruption of teeth of these patients. Why this occurred? Because there is no osteoclast proper formation, so this caused no bone resorption for formation of eruptive pathway which needed during eruption, so this caused delay in eruption pathway. That's all for this lecture, and thank you for listening.